So, okay, and now I'll go on to Matt Reddy.
Hi, I'm Matt Reddy. I'm one of the hospital commissioners for Jefferson Healthcare. And I just agree, Zoom is so efficient, especially if you're getting this many people. It's so, but I'd be down for an in-person thing like once in a while.
Okay, good to know. Peggy?
Well, I agree with both Matt and Patrick that it's nice to be in person, but as you know, I travel in and out, and like the next 2 months I'm going to be away, so it's nice to be able to join.
Yeah, and we like having you here. How about Sheriff Noel?
Joe Knoll, Jefferson County. I'm fine for in-person meetings, but I totally get what everyone else is saying. Kind of like when we got cell phones or pagers back in the day. It actually, since we can meet online, it actually makes us do more work. So having the travel time, we'd have less things to do, and we could drive more often. So, but yeah, either way, Zoom has definitely become convenient.
Matt, how about Jim Novelli?
I prefer in person, honest with you. I really like the ability to network and talk with people about things outside of the meeting or set up things. Zoom really kind of it makes it hard to network as much as you can. I mean, you can do both. You can have network, and people that travel can do Zoom into a meeting and have in person. But I'm very much used to being in person and meeting people and talking about things. It's just my preference. So.
And we all want to see Jim in person, that's for sure.
No.
Are you recommending that as a mental health professional, that it's best that we meet in person?
Absolutely.
Good.
I've seen a big difference now that our staff are back in the building already, how much they're interacting with each other and what a difference it is than they being isolated, you know, doing stuff from home. So really made a big difference in their approach right now. So.
All right. How about John Nowak?
Hi, I'm John Nowak. I'm a co-executive director for CHIP, and I think some kind of a combination, maybe Zoom quarterly or something like, or meeting in person quarterly and then 2 Zoom meetings in between. Because I agree there's convenience to Zoom, but there's also an advantage to being able to see people face to face.
Okay. Cherish?
Hi everyone, I'm Cherish with OliCap. You know, I appreciate a hybrid model. I think for people that can make it and have access to where locations are at is good, but I think for accessibility purposes, people with disability, people with social anxiety and other issues, I think that, you know, having Zoom as an option is really great. So I'd like to see organizations that can do it ensure that they've got, you know, a big screen, so where everyone's meeting, you know, people can see who's talking. And I think that technology will continue to improve as time goes on. But I think when we're talking about, you know, accessibility, and then those of us that have tight schedules, right, may not be able to get to the meeting, right? But I might be able to catch the meeting online because I've got something right after it. So, so I really like the option of hybrid, and, you know, yeah, I'm happy to assist in whatever it takes to make that happen too. So.
Okay, thank you. Jen Haynes?
Thanks, Lori. I think what John said and what Cherish just said, I agree with. Anything that's other than an all or nothing approach, definitely in favor for, whether it be quarterly or even if it's just every month. And there's the option for people who are out and about who can't make it, that'd be great. So.
Okay. Jolene?
Oh, Jolene Kron, Deputy Administrative Clinical Director with the Salish Behavioral Health Administrative Services Organization. I also kind of agree with the hybrid options, or like the quarterly in person. I agree with Jim that there's definitely value to face-to-face connection as we're having some of these conversations.
Okay, thank you. Chief Olson?
Chief Olson, Port Townsend PD, I would be in favor of a hybrid. I like the convenience of jumping on here and jumping off and being able to do other things. But also, I don't think I've met most of you in person, which would be nice. So
You're here. Okay. Chief Black?
Scrambling for the mute button there. Thank you. Brett Black with EJFR. My response to the meeting question is kind of two answers. On a personal level, I think as a public servant, I definitely got into this line of work, 20 something years ago, almost 30, because of the personal connection. And I feel that that is one part that's been missing during the pandemic. But to kind of echo what some people said, including Chief Olson, I am more efficient with virtual meetings. And, just for today, I've got my schedule pretty much blocked out for the whole afternoon with virtual meetings that I would have to add driving time to all of those normally. So I am able to get more done without having to zigzag all over the county. And then there is one aspect that you might not be aware of, but currently the governor's order does allow governing organizations such as the county, the city, and East Jefferson Fire District to continue with virtual meetings and to start doing in-person meetings. But the one thing that we aren't legislatively allowed to do is exclusively in-person meetings. We still have to have some version of a virtual element as of today. But I know that may not apply to this group. I don't know enough about CHIP's structure and alignment with what the governor's order is for elected officials.
Well, the one place that I can think of that would be big enough for us to offer that both would be that conference room out at the Chimacum Fire Department. So that might be something that we think about.
Yeah, that's definitely something to think about, but technically we're still closed to non-employees. So we don't have a person power to right now focus on all the regulations with everything else we have going on.
That makes sense. All right, Commissioner Eisenhower.
I agree with much of what has been said about the hybrid meetings. I know that I'm on now 29 committees and my calendar is really juggly, and travel time, even 10 minutes or 15 minutes from the courthouse to a meeting might make me a less effective participant in the meetings, but I am a people person 1000%, and I have never had an in-person commissioner meeting, and we've just been down the hall practicing that. So next Monday, we're starting with hybrid commissioner meetings. So I encourage anyone who wants to come see us in person, but we will be on Zoom and AV capture as well. And it's been really hard for me as the people person that I am to be in this kind of virtual state for now almost a year and a half. So I'm a big proponent of hybrid meetings.
Okay. Vicki Kirkpatrick.
Well, my preference is almost always meeting in person for all of the reasons that have been stated. However, I can accept a hybrid model. The only caveats with that is sometimes, having participated in some hybrid ones, oftentimes it's very difficult to hear what everybody in the room is talking about as they're talking amongst themselves or each other. Versus the Zoom where you can hear everybody individually. It will create, meeting in person will require some adjustments of meetings because of travel time. Right now, our calendars can very quickly get booked up solid with meeting after meeting after meeting, which you can do via Zoom, difficult to do in in-person meetings.
Thank you. How about Denise Baker?
I'm Denise Banker, and I am the coordinator for the Community Prevention and Wellness Initiative, which is a alcohol, tobacco, and substance prevention program. So I am, in favor of hybrid meetings because for all of the reasons that have been stated. So thank you.
Thanks, Denise. And James Kennedy?
Hi, so I think I'm going to sound like everyone else. I generally really prefer in-person meetings, and for the most part, I am excited to get back to them. The tricky thing is that with this meeting is I know we've had different meeting locations at different times, and I'm pretty sure I could make meetings in Port Townsend. I am not quite as able to commit to them if they're going to be held in Chimacum.
Thank you. Well, we want you there. Apple Martin.
Hey everybody, I'm Apple. I'm the Community Health Division Director at Jefferson County Public Health. I'm in favor of the hybrid model. I also want to make a plug for in-person and the commute time it does incur, simply because I need the break.
There you go.
I know we all want to be more efficient, but something I've learned about pandemic trauma is that we all want to do way too much. So I'm 50-50. I love being with people. I'd like the commute time if I can make it, but the hybrid model makes the most sense with the wide variety of people's needs. So that's where I'll land my stance.
Okay, thank you. Brian Richardson.
Hi everyone, Brian with the Raspberry Cafe. I don't have much to add, but as I do agree, in-person communication is just more efficient, more effective, in my opinion. I like the networking that happens before and after the meetings. And like everyone else, my calendar fills up just as much more quickly now. So I like John's suggestion of maybe doing some of the meetings on Zoom and making our best effort, perhaps quarterly or however often that might be, to meet in person.
Okay. How about Dave Fortino?
I was unmuted this whole time, sorry. Yeah, I find the Zoom meetings to be more efficient. And as we kind of done more of these meetings over the last year and a half, I found my calendar fills up quite a bit more now than it used to with in-person video meetings. But I'm kind of either in-person only or Zoom only. I don't like the hybrid mix just because it makes it so difficult to communicate between the two different platforms. You become more of a spectator when you're doing a hybrid and you're on Zoom than you are a participant, I feel. So those are my preferences.
I think that's a true concern there. How about Lisa Thomas?
Everybody, Lisa Ray Thomas, University of Washington Addictions, Drug and Alcohol Institute. And I think I figured out what the question was. Sorry, I was a little bit late. So I really miss in-person meetings and agree with pretty much everything that's been said. Seems like quarterly in-person meetings might be too far apart. So I wonder if every other month Zoom, and I like what you said, Dave. So Zoom 1 month, in-person 1 month. That way you don't miss too much. Thank you.
Thanks, Lisa. And Adam York.
Oh, I'm already unmuted. Yeah, so I just walked in a little bit late too, but I do enjoy not having to commute between a meeting, like going right back into and having the PC and all my resources right in front of me. So I enjoy that aspect of the Zoom, but I also see the value in networking with the networking that the face-to-face brings. So I like the idea that seems to be going around of having a hybrid.
Okay. And Gabby cut out.
Can you hear me?
We can hear you.
Okay, I'm just
outside the jail because my internet in there sucks. What was the question?
So we were just asking whether folks preferred in-person or Zoom meetings as things start to open up. And we think about this meeting.
I think that I prefer in person, just because it's easier to communicate with people that way. I do like being able to Zoom, but and not have to be somewhere. I like that aspect, but I enjoy meeting with people in person, and I think we're able to communicate better overall.
Mm-hmm. Okay. Have I missed anybody? I'm looking. I don't think so. Thanks, Gabby. Well, I think what I'm hearing is we all had a computer in front of us and we were in a room together, and the requirements or regulations around whether or not we can do that were so that everybody can do that. That would be great. But it is wonderful also to be able to just hop in from wherever you are, and it makes sure that we have a pretty good attendance at this meeting. So John and I are going to step back, think about that a little bit. Maybe we'll do the hybrid, which is some in person and some not, and more probably for the moment anyways, we're going to stick to a Zoom format and look at maybe in the fall, looking at an in-person meeting. So I wanted to give a couple of updates before we jump into, we've got Chief Black here who's going to tell us a little bit about EJFR. I'm going to share my screen. Today we're going to go over some updates, and then we've got looking at the sustainability of this consortium. I've got East Jefferson Fire and Rescue's Chief Bret Black here to tell us a little bit about the department and his leadership and the priorities that they're looking at. And then we're going to continue a bit of a discussion that we had started last meeting with Jolene Kron about the 2021 legislative funding measures or updates and funding measures that are out there. And then depending on time, we'll talk a little bit about how we might optimize our funding resources across the county. Quickly, wanted to let you know we did get information submitted for our third quarterly, and when we say third quarter, that's third quarter of this grant, which goes through August of 2023. So we're not quite a year in. At our next quarterly mark, we'll be doing another one of those performance indicator reports. So I'll be coming back to you folks for that probably toward the end of August. Wanted to give you a bit of an outline of what we reported at this Q3 milestone point. They ask you for, to describe 3 successes that you had, and I chose to focus on the fact that we have great consortium engagement, probably because we're all on Zoom and we're being totally engaged in so much right now. And I outlined a few of the topics that we focused on. On the data and reporting, it seemed in the last 3 months, we've done a pretty good job. We've had a report out of our collective data that Lisa Grundle gave us. And then we're also working on the law enforcement data normalization across our police department and our sheriff's department. So some good progress there. And then noted that the Recovery Cafe's reopening is something to be celebrated and a good success, which provides us both with peer-based recovery support and of course service connection, which can be harder to do when you're in just a Zoom environment. And then on the challenges, I focused on 3 things. One is one of our projects that we had outlined to do with this grant had to do with care coordination. And some of the things that we're encountering that need to be in some way left over as barriers or just generally figured out are how we're going to handle the CFR 42 Part 2 for service providers, the release of information between providers by the patient, as well as the fact that the project in general was conceived when we had different people in leadership at some of the agencies that are on our consortium now. And so there's an opportunity for us to sort of relook at what that plan was and does it still suit us now with the priorities that the various agencies have under new leadership. And then generally, I noted that I think a lot of us just have sort of an organizational exhaustion because of so much bandwidth being put out toward things that had to be dealt with in terms of COVID-19. And then all of that exhaustion might be part of what is also figuring into the workforce retention and recruitment issues that we've been having at some of our agencies. I know that there's just critical incident stress, and maybe that's the lingo for the fire department, but I think you can probably say at public health, there's similar just exhaustion and a lot of people retiring, and just this switch up in workforce has made an opportunity for new priorities to come up. And one of them, of course, is that workforce retention and recruitment, as well as the fact that with new people coming in, they view what needs to be done first through a different lens. So I'm throwing this up here, these projects that we had committed to when we got this grant. Just not everybody, I haven't even had a chance to sit down with, say, the new person over at Jefferson Healthcare or the chief of police at the Fort Townsend Police Department to talk about what is involved with this grant and what we talked about doing. But this list of projects is something that I think it bears revisiting, and something we'll probably start doing in earnest next month. At the time that we set up this program, we outlined what our different actions and projects were going to be and how they would impact at these various intersection points in our effort to improve access to substance use disorder services throughout the county and throughout these various intersection points. One of the projects that I want to talk about that we have made some excellent progress on is the harm reduction effort down in South County. Last month, we were able to have Dr. David Carlbaum, who is the medical program director for the emergency medical services across Jefferson County. He gave a presentation at the June's Jefferson Educational Partnership meeting. And that meeting consists of a couple of representatives from each of the boards of the school district, of each of the school districts. And he gave a little bit of an overview of how naloxone is, something similar to an EpiPen or a fire extinguisher in terms of being ready for an emergency. And I think 2 of our schools have naloxone policies. And then we have another school district that hasn't gone there yet. And this was an opportunity sort of to introduce the topic in a gentle way. And then we'll probably start looking more closely at the Quilcene district, as that is our first step to doing harm reduction down in South County, is to start getting naloxone, and not just in schools, but set up so that there are distribution points that people can come to get it down in that area that doesn't have easy access to the syringe exchange program or harm reduction program that's up here in Fort Townsend. Some other highlights with that harm reduction effort, we've had John Nowak, of course, has been working with me on that. And as he retires, we're going to need to identify a new representative for that effort from Jefferson Healthcare. We're waiting for insight on whether we can use the Quilcene Clinic, Jefferson Healthcare's Quilcene Clinic, as a naloxone point for both receiving it and distributing it. And in general, I think that this meeting, while we are focused on harm reduction, it's actually an opportunity for the leadership there, as well as, the commissioner and public health. We've got some representatives of various organizations throughout the county, but sitting there around a table once a month focused specifically on South County. So I think that that's a positive that's coming out of that one project. And then in terms of communication, I wanted to highlight to you guys that August 31st is the Overdose Awareness Day. We have a campaign that we put together that public health is going to be putting out. And if any of you are interested, I'm happy to send you links so that you can share it on whatever your social media is. It's all taken from Stop Overdose, which is a qualified program. So you know, it's got good facts going with it. I hadn't realized that there was an opioid overdose day or opioid overdose awareness day, but apparently Washington State did that here in 2021. And I've spoken a little bit about how we have several organizations that are experiencing an evolution in their leadership. And I recognize that does give us a chance to get to know not just the new leaders, but what they're seeing in their departments and how does that fit with what the consortium had laid out to do, and maybe how should we evolve it. There's been a lot that's happened since we did that plan. We've had COVID, we've got this new leadership, and we have other key positions that are also retiring out of the system. And so one of the things that I wanted to focus on for this meeting is to give Chief Bret Black from the fire department a chance to give us a bit of an overview of what he is seeing and his department. And I've had a chance to talk a bit with him about the consortium and what we're doing here. So I'm really looking forward to what we might do together in the future. And Bret, you tell me, would you like to have anything up, or would you like to just have it so that you can see people's faces? And you might be on mute.
If you would you mind if you shared screen with me?
Sure. See if you can do it. Can you do it?
All right. Can you see that?
Yes, we can.
Yeah.
All right.
Great photo.
Don't tell my kids that I solved a technology issue without them. They'll feel very empowered to ignore me from now on when I ask for help. Okay. Well, thank you, Lori, for letting me take some time from everybody. Just a little bit of background on me. I'm one of the new people that Lori alluded to. I came from the city of Piedmont, which population-wise is the size of Port Townsend, except crammed into 1.7 square miles. So it's a very dense city, about 100 years old and change, and completely surrounded by Oakland, California. So the social economic issues of Piedmont were very different from the neighbors all around us, which led to interesting paradigm when we collaborated with them as well. But I'm happy to be here. About this time last year, I was going through the final recruitment process, coming up here a couple times with my family, and just fell in love with the area. And eager to, kind of get out of the mayhem in California at the time we were going through a lot of the riots that I'm sure all of you saw on TV. So this picture actually fell in my lap, metaphorically and physically. The artist lives in Paulsbo, and she took this picture about 6 months ago. And if you zoom in real close, you can see our ambulance on the ferry. And so what's really great about this picture is her passion. As soon as I asked her for permission, I couldn't even finish the question, and she said absolutely. And just to give her proper credit, at the bottom there, you can see her name if anybody's interested. But I have this printed also for our office. It's just such a great picture. And that kind of just highlights, one of the things that you may not all be aware of is we're a fire district, which is an independent governance organization within Jefferson County. There's 5 districts, fire districts in Jefferson County, and we are technically District 1. And to make it more confusing, on the picture you see on your screen, we have 5 districts within District 1. So we have a commissioner for each of the zones, if you will, within the district, within District 1 boundaries. And that's commonly referred to as East Jefferson Fire. So all of the colored areas in this picture is East Jefferson. We go from uptown all the way down to Chimacum, and even all touch 104 a little bit there in the south, and Maristone Island. I don't want to forget them either. And we have, 5-member board that, they're represented by some great people. Some of them are former firefighters, some of them are former city council members or county officials, and they're all really invested in the community. And then this is the picture of the commissioners. If you see any of them, please feel free to give them insight into your desire. But they're a great team to work for. And we're some interesting things about our fire district is almost 95% of our employees live in Jefferson County, which is a really unusual paradigm for a fire department. And what a lot of people don't understand is we have 6 fire stations, but only 3 of them are staffed. And those 3 stations are staffed 24/7 with just a few people each. Our minimum staffing level is 8 people per 24-hour period. And that's it. There's no more firefighters in a box that come out when we need help. So when we send an ambulance for a 911 transport or a fire engine or even a large incident or structure fire, you're only getting 8 people from East Jefferson. Hopefully we can get some of our great volunteers to come too, but usually they're not there for at least 10 to 20 minutes later. And they really help us with kind of cleanup or the second phase of the emergency. And according to national standards, a fire department should be able to put 16 firefighters on the scene of a structure fire within 8 minutes or less. So you can see we're really thinly staffed. And then when you add to that paradigm, the fact that we need to be able to also transport some of our critically injured people outside the district, then that depletes our forces even lower. So it's a real interesting fire department that I kind of, really felt drawn to because of some of these challenges, but we wear a bunch of hats, and some of us are paramedics, some of us are EMTs, some of us are exclusively firefighters, but we all live here and care about the community we serve and have a lot of passion for how we serve and represent the community. Some of the highlights of our volunteer program are up here. We have about 44 volunteers that are active. Some only do medical, some only do fire, some only do office work. I'd like to see those numbers go considerably higher because volunteerism, I think, is really alive and well in Jefferson County. And I think there's room for a lot more growth there. And then some of the support services you may or may not know, we also do fire prevention, fire public education, and we do inspections. We're actually mandated to do inspections by WSRB, the Washington State Rating Bureau, kind of like ISO, which sets the score for how your community's insurance rates are set. So when our score goes higher, 10 is the worst, 1 is the best, your insurance rates go up correspondingly. So that's why you see us going around to businesses and the hospital and other facilities and doing inspections because we're trying, that's a regulation part of the Washington State Fire Rating Bureau that we conduct those inspections and track them. And if anybody has a question, just feel free to interrupt me. I'll just ramble on forever if you let me. And then this is kind of a graphic on what it costs to maintain our stations, relative to our budget. So a lot of our stations are old. We only have 1 station that's fairly new. The rest are kind of duct tape and baling wire, more or less. And then our fleet is unfortunately also kind of antiquated. The bright or the orange color shows that we lose points for that WSRB rating. The red is we receive additional deficiency points. So we're going to have some challenges with our budget coming up. This is a great picture of our ambulance, again, going to Seattle. We transport critically ill patients with our fine EMTs and paramedics across the Bay and other areas for more advanced care routinely. And this is what it costs as far as our fleet. And our fleet's worth approximately $8 to $9 million if we had to replace everything.
Hey, Brett, this is Cherish. I'm curious, when you make those calls across the water, do you get charged for being on the ferry, for having the vehicle on the ferry, or is that?
Yep. There's no free ride.
No free ride for you.
Yeah.
Huh.
Yeah. We have to pay the same ferry charge that all of you pay, but we are reimbursed, through either their insurance or the hospital. Depends on the contract and the destination that we're going. So we do recover our costs, but we have to pay just like you to get on the boat.
Okay. And is there a reason for the districts being broken up the way that they are? Is that ever realigned or looked at, or this is the way it's been forever and this is the way it's staying.
Well, as the new guy, I'll say that I'm still learning that, but
Okay.
I'll speak for I'll speak for East Jefferson Fire District 1 is actually the newest district in the county because we've morphed several times over the past 15 years or so. So we used to be separate, even more districts. There used to be a Chimacum district. There used to be a Cape George district. There used to be a Port Townsend Fire Department, independent of everybody. And so we've actually consolidated all those into one. And there is some economy that you realize when you don't have to have multiple fire chiefs for each of those districts. And that's usually why districts kind of merge together. But there is kind of a subjective breakover point geography wise that would be challenging to overcome if we were all districts in the whole county were to merge into one. Because I mean, it takes from Port Townsend just to get to my home in Port Ludlow is about 35-40 minutes. So it, at some point it doesn't make a lot of sense to combine with Quilcene Fire District or Brennan Fire District. It's just logistically too difficult to manage over that size of geography without additional chiefs. But a lot of it's also the will of the constituents. Every time a district merges or consolidates, the residents have to vote on it. And there's different revenue streams that come in depending on what district you live in. Your taxes are different in Port Townsend or Port Ludlow than they would be over in Quilcene, based on what you as a resident decide to tax yourself. So a lot of that is also driven by revenue. Does that answer your question? Kind of a long answer. Sorry about that.
No, that gives me a rough idea. So being new here relatively as well, it's just trying to get a sense of stuff. So thank you.
Chief, what does your revenue stream look like? Is the majority? I assume the majority is from from taxes.
I'll get to that here in just a slide. Here we go. So that's our revenue stream. A lot of it comes from taxes that all of you pay. Thank you. Some of it comes from insurance company reimbursements for our EMS services as well. So you can see down at the bottom, the 2020 revenue, majority of it comes from real estate and personal property taxes, 6-point-something million dollars. And then transport fees from our ambulance and other fees that we recoup our expenses make up the difference. All right. I like to say, I'll appropriate the city of Reno's phrase that you see on their sign. We are the biggest little fire department in Jefferson County. We are the largest of all the 5 districts currently. And then this slide talks about our Medic 17 program, which is referred to as a IFT or interfacility transport. And these are EMTs and paramedics only. They're not firefighters. And we have a contract with Jefferson Healthcare to transport their critically ill people when they can't fly them out to a higher level of care. Sometimes it's going to St. Michael's, sometimes it's going to Harborview, sometimes it's going to a behavioral health clinic. And we have an agreement with Jefferson Healthcare that helps offset some of those expenses. And then just kind of reviewing some of our goals. And I think Lori put the link in the presentation, but if anybody wants a copy of this, it's on our website. Just scroll all the way to the bottom, you'll see it, ejfr.org. But this is the year of analysis for East Jefferson Fire Rescue. Actually, today, we just met with an ad hoc committee of internal stakeholders to determine who is going to put together our strategic plan and standards of cover, which is going to really be a front to back assessment of where we are, where our gaps in service are, and identify opportunities, including revenue, for us to grow. Because as I illustrated earlier, we're severely understaffed for the risk that is presented to us, especially the geography element as well. So our stations typically only have 2 to 4 people on duty per day. So those are some of the challenges we're hoping to assess this year through all these analysis. Any questions? All right, I will unshare or attempt to unshare. Sorry, still trying. There we go.
Thank you, Chief Black. I love to see a well-organized report there. I've put the link for that in the chat box, and it is also in your presentation as well. Welcome you having a closer look, and if you have questions that you come up with afterwards, I'm sure the chief would welcome emailed questions or bring them to the next meeting. For our next segment, I invited Jolene Kron to come back and give us updates. We had a rather truncated, substantial amount of information that she gave us at the last meeting, and I'm excited to hear what updates there are now. We did have we called it the open office hour, where Jolene answered some questions from folks and gave us a little bit of update even at that stage that maybe she'll summarize here. So go ahead, Jolene.
Okay, so I'm just going to provide a summary of kind of some updates, and then if there are questions, I'd be happy to do that. So I will start with the substance use disorder outreach positions that we expect to bring on this fall. The state, the healthcare authority, is developing the uniform standards for that. So we still do not have parameters for those positions, but that work group at the state level is starting next week. We expect to have parameters by the end of August, again, to roll out as quickly as possible once we know what we're rolling. I think that is the biggest challenge at this point. As part of that, it is an outreach navigator position. It is intended to fill the role of referral for law enforcement related to House Bill 1310. So we are hopeful to get things moving as quickly as we can. In connection with that, we did facilitate a navigator meeting across all 3 counties a few weeks ago. That meeting went tremendously well. We missed the folks from Jefferson County. Sheriff Knoll was there, but the navigators were both otherwise occupied. I did just see, notice that we got a second meeting scheduled, and everybody was on board with that. So I think it is a good place for us to start related to the navigator programs across all 3 counties. So Jefferson, Kitsap, and Qualam. One of the things we didn't get to at the last meeting was to talk about housing subsidies and supports, and we do have more information related to that. The Department of Commerce was awarded $9.3 million across the state to enhance behavioral health housing. It's called CBRA. Community Behavioral, I can never remember what it stands for. I even wrote it down. It's Behavioral Health Rental Assistance is what it stands for. And we are working right now. We just got our revenue contract yesterday. And so we are working on our subcontract with OLICAP to provide $50,000 in bridge subsidies. When we talk about subsidies, those are funds directly paid to landlords on behalf of individuals. So $50,000 in bridge subsidies for folks with behavioral health conditions. An additional $10,000 specifically for the substance use disorder population. That is double the allocation from our last contract period that just ended June 30th. So that is exciting. And with the addition of the commerce funds that I just mentioned, last year, Jefferson County received $10,838 in subsidy. In this next year, effective July 1st, just a few days ago, Jefferson County will receive $42,725 for specific subsidies, and we will be able to provide to OLICAP some operational costs, which has never occurred before with the funds that we are talking about. So that is very exciting news. So we are looking at a substantial amount of funding coming to provide subsidies. Again, this is specific to the behavioral health population as a target and individuals who are coming out of inpatient settings and need additional support. One of the additional challenges related to commerce is the previous funding was more limited related to long-term housing placement and supports. We are allowed with this newer funding to also provide some what they refer to as bridge funding as well. So some shorter term for an individual who may come in and qualify for HEN, but won't qualify for a couple months, we can kind of fill some of those gaps with some of these funds. So we are very excited to get that contract in place as soon as possible. One other funding source that is on its way. So we did release our, from the Salish BHASO, the Substance Abuse and Mental Health Block Grant RFP. So 2 separate RFPs, those released on Tuesday the 6th. The Mental Health Block Grant is $250,000, and this is for treatment services, stabilization services, as well as some training services. And 25,000 of that is set aside for community-based training so that it can be requested from entities within the community to provide behavioral health training. On the substance use disorder side, we are releasing, or the RFP released $555,000. And again, this is across all 3 counties, not specific to Jefferson. And 45,000 of that is specifically earmarked towards behavioral health training opportunities across the region. We do have a mandatory bidders conference. So we will know who is in the pool and eligible for that RFP, and that is on July 14th from 2 to 4. If anybody is interested and hasn't received information, please reach out to me. I can get you the Zoom link. We are doing that by Zoom, so everyone can have access. So that is the block grant. It will close on August 5th. So those decisions will be made, and the funding period for this is expected to be October 1st, 2021 through March 31st of 2023. So a little bit longer, and this funding comes from the CARES funding. And we do expect, again, this is one-time additional, like what they call it, the enhanced block grant. It is additional block grant in addition to what our annual allocations have been. And there is expectation, at least expressed at the state level, that in March of 2023, there will be a second round of this funding that comes from ARPA. So they are holding the ARPA funds to extend the timeline, and those would go from 2023 to 2025. So we will keep you updated if any of those things change. Yeah, just wanted to also give a brief summary. We released our SUD-CJTA, the Criminal Justice Treatment Account Survey. We are nearly done at writing the report, but just some of the preliminary results out of Jefferson County. We had 14 respondents out of Jefferson County. That was 7% of the total. I think the total was 206 in all 3 counties. 76% of those were between the age of 42 and 65. So we need to work to target some younger population. 100% of those were white. But we did identify priorities for Jefferson County. And interestingly, the priorities across all 3 counties were fairly in line. One might have been like 2 was 3, 3 was 2 in the counties, but outpatient treatment, case management, and youth treatment and residential treatment were the 4 identified in that order for Jefferson County. And when we talked about housing or recovery support services, housing was number 1 by far. And second was transportation services, with relapse prevention coming in kind of a distant third, but definitely housing and transportation were identified as some of those top priorities for Jefferson County. Okay, that's all I got.
Thank you, Jolene. That was a lot. Does anyone have questions?
Patrick had a question in the chat that said, well, I mentioned the types of agencies eligible to respond. So we did split the RFP for both mental health and substance abuse block grant. So there are entities can request funds as a treatment agency, and those individual agencies would have to be licensed by the state behavioral health agencies and be credentialed with the Salish BHASO. We also, for some of the recovery support services, have opened that up a little bit. So the transportation, some of the training funding could be available to other entities such as OLICAP as one of our contracted providers, but we have reached out to OESD, some FQHCs across the region, and other support agencies, we are willing to look at those options. So social service providers for the recovery supports, not for treatment services.
Great. Thank you.
You're welcome.
Anyone else with questions?
I don't have a question, but just I wanted to thank Jolene for coming and speaking with our group. It seems like you're coming to all of our things now in Jefferson County, so we'll make you an honorary member of the county.
I greatly appreciate it.
And we love how much information she always has, so I'm grateful that you could be here. Okay, as we talk about funding, I'm going to share my screen again here. One of the things that we have just begun to scratch the surface of is to try to get our arms around the funding that we have going on across our county as it relates to behavioral health. And even that seemed a little bit broad. So at our, we had a small group meeting that sort of talked about how we might get our arms around this. And something that we have started to try to fill out, and I'll be coming to service providers and folks that are here at this table probably over the next month. We set up a table that has, you'll see across the top, we have those intersection points that we've talked about before. And here we are focusing just on the justice involved population. So where might we intercept those folks, whether it's at community services, at EMS or along, at perhaps an initial detention or court hearing, or at the emergency department. And then our next stop is at the jail courts treatment interception point. Then when they re-enter the community, and community supervision. So these are all intersection points that we might actually connect people with services. And of course, the goal is always to connect folks with services before they hit a crisis point. What we thought is if we took each of our providers and put them down one side, and then at the intersection point started to note the different grants that we all have, we could begin to understand across our community where are the gaps in our funding, or where do we need to start thinking of strategy for the next round of funding that's going to be needed to continue programs that are working. I have just barely started to put in some that we know from 0.1%, and I'm looking forward to coming back to, I'll be talking to Teresa Worth over at Safe Harbor, and Gabby, and probably Tanya over at DBH, maybe Cherish over at OLICAP, just to see if we can start to really fill this out. One of the things that I have been realizing, and that I just heard Jolene allude to, is that when it comes to that age band of the young adult, there is an opportunity, I think, for us to beef up what we're offering in terms of service connection. And to that end, Kelly Parcher, who has just finished the remodel with some affordable housing funds that came from the county's 148 and 149 funds. She has completed the, I think it's pronounced Pfeffer House, the Pfeffer House Young Adult Transitional Living.
Pfeiffer House.
Pfeiffer House. I hear it pronounced both ways. Okay, Pfeiffer House. So I'm going to have her come and give a bit of a presentation on what she has going on there. I think that she might be somebody we consider adding to this consortium, and thinking about how we can support the service connection that's going on with the young adult population that she's reaching out to, and possibly use it as a place to nurture some peer network development for the folks that are in that program. So that'll be coming up at our next meeting. Then that's just upcoming meetings. Wow, could we really be at 3:55 complete? That's impressive. Let me come back so I can see everybody. So those are some things that are out there that I wanted to make you aware. I'd be coming back to you on, both with that spreadsheet that we're looking at. Are there any questions before we let folks go? I know we've covered a lot in today's meeting.
Lori, it looks like there's a question in the chat box from Beth.
Oh, thank you. Hold on, let me find that. Did we mention the emergency department
As an intercept point, Lori, I think is what she was asking.
Oh, yes, it is on that chart.
Okay, good.
And yes, we are definitely going to be going back a year or two. I know that the hospital had some funding for some of the mat work that they were doing. So it will be great to go back and fill out that chart with what the hospital has as well. So thank you for bringing that up.
Thanks.
Anyone else?
Lori, I can't remember if we've already announced that the CPWI program achieved funding for a community in Quilcene School District. Have we already announced that?
We have not, and I'm really happy you brought it up. I wasn't sure if you had announced it. I was going to make a big, bubbles going off and big flashing. 740,000, I hear.
We responded to a request for application, and our proposal was accepted, and we received over a 2-year period a substantial amount of money. So it means that there are now 3 of these coalitions in Jefferson County that are working in the school districts to prevent alcohol, tobacco, and other drug use and abuse. And we almost are funded at $1 million every 2 years for these 3 coalitions. So it's a pretty substantial amount of money to not only support employment, but also to support programming for students, right, and the community. So we're pretty happy about that. And as it is connected to naloxone, we will be working at the school district in Quilcene now, because we have the 2 policies already achieved in the other 2 school districts. And so we'll be working with Sean and the superintendent, whose name all of a sudden just jumped out of my head. We'll be working with them to establish a naloxone policy.
I bet it's Frank Redmond you're thinking of.
Yeah, Frank, yep. I don't know why I couldn't say it. I know him and I'm friends with him, but I couldn't say it. So thanks for your help.
Well, I think it'd be great to have you 2 down at that South County harm reduction meeting that we're doing, since that very much intertwines together. So congratulations, great job bringing that money into the county, and exciting that we have a consistent program across all of our school districts. And prevention, it saves so much money further down the road. So I'm glad to see, Denise, that your efforts and that of your team have been so successful.
Lori, I just wanted to say, I remember when the 3 county coordinated opioid response project overdose prevention work group was wanting to get naloxone into the schools in the Olympic region in 2017 and 18, and people were like, naloxone in the schools? Why would we need that? So I'm so excited to hear that this work is being done, and thank you for that, especially with fentanyl coming into our state and hitting youth really disproportionately. So thank you for that work.
Yeah, and Lisa, thank you for sharing the LACE and lethal, the resource for youth fentanyl in the chat box there. It's helpful.
Yeah, it's pretty King County oriented, but it can be adapted.
For sure. Okay, everyone, thank you so much for coming today. We'll look forward to seeing you next month, and I'll probably be talking to most of you individually in between. Have a great week.
Hope to see you in person soon.